Okay. So, good afternoon, everyone. We're happy that you're joining our roundtable discussion around diabetes from a local and regional and global perspective. I would like to start by welcoming our panelists and experts for this discussion. Let me first start by introducing Dr. Refqi Mahmoud. Dr. Refqi is the head of the Cardiovascular Disease Prevention Department at the Ministry of Health, holding a certificate and a specialization in community medicine, public health, and epidemiology. He has been working for more than 15 years in the field of prevention of non-communicable diseases, and especially in cardiovascular diseases and diabetes. Dr. Refqi has been long participating in not only conferences, but also in monitoring NCDs through implementation of national surveys and monitoring of daily indicators of high blood pressure and diabetes in hospitals and healthcare facilities affiliated with the Ministry of Health. Dr. Refqi, welcome and good evening. We also have with us here Dr. Ibtihal Fadil, the founder and chairperson of the Eastern Mediterranean NCD Alliance. Dr. Ibtihal is a medical doctor with a PhD in public health and has worked on NCD control from a government and civil society levels. She has been a WHO regional advisor on non-communicable diseases and has worked with more than 8 years with different civil society organizations and networks to fight non-communicable diseases. She's also a board member of the Global NCD Alliance and other regional societies working for the prevention and control of non-communicable diseases, including cancer and diabetes and other genetic diseases, and of course, tobacco control societies. So good evening, Dr. Ibtihal. It's a pleasure to have you with us. I will also like to introduce our speaker and partner for today, Mr. Jacob Madsen. He's the senior advisor at the World Diabetes Foundation with a particular involvement in diabetes in humanitarian settings. Mr. Madsen is a social anthropologist with 20 years of experience in the field of global health management. He has been working in global health and communication and has a long experience in behavioral science approach strategies and programming with various health areas, communicable and non-communicable, and also in multiple countries and multiple settings, including Latin America, the Caribbean, Europe, and the MENA region. And also, he has worked actively on multilateral and bilateral agencies, government and the private sector, and NGOs that are in the health sector, and especially in low and middle income countries. The World Diabetes Foundation is a partner with us in these series of roundtable discussions. And as we are coming close to the World Diabetes Day, they have been supporting Jordan in multiple ways, and we are grateful to have them on board today. I would also like to introduce our speaker, Dr. Omar Abawi, also as the Caritas Jordan Programs Manager. He has more than 18 years of experience with Caritas Jordan in specific, and he has had various positions within the organization, and currently as the program manager, he oversees multiple projects of Caritas, and part of which are related to the health programs and interventions, and specifically in the humanitarian settings. serving multiple refugees and groups. Moreover, he has a degree in political science and international relations and participates regularly in multiple national, regional, and international conferences and related to immigration, civil society, and local development, and also enhancing the role of faith-based organizations on the ground. So again, I would like to welcome all of our speakers for this discussion. And we are ready to start with our first question directed to Dr. Refqi Mahmoud. Dr. Refqi, Jordan recently has done in collaboration with the WHO steps survey and has, in 2019 worked to receive and monitor where do we stand as a country from non-communicable diseases and risk factors. And the results have come out recently, and we would like to seize this opportunity today in light of the World Diabetes Day to understand more how are we doing in Jordan with regards to diabetes in light of the recent findings.
Okay, thank you very much. First of all, I wish a happy day for everybody. And I really would like to thank Royal Health Awareness Society for hosting me in this very important panel. I'm really very happy to talk about very important topic that constitute a real burden on the patient and on health system in Jordan. I would also like to extend my thanks to RAS for their constant interest in celebration and reviving the global health days. I will focus on the epidemiology of diabetes mellitus in Jordan and talk about the numbers that we have. As you said, we just finished the analysis of the stepwise survey in Jordan 2019, and we found this numbers we can talk about. First of all, about the prevalence of raised blood glucose, we found out that 8.2% of the population more than 18 years, they have diabetes mellitus. And we found out that the impaired fasting glycemia, the prevalence was 6.1%. And we found that 18% of diagnosed patients, they never take their medications. It's very high persons, 18% are not taking their medication, even they know that they are diabetes. And also we found out that 11% of patients are taking herbal medications. They are not taking the medication from their doctors. They know they have diabetes, but they are taking only herbal medications. Also, we found out that 56% of the population never check their blood glucose. More than half of the population, they never check their blood glucose. So they don't know if they have diabetes or not. Now, about the controlled patients who are going to our health centers or who are taking their medications, we found out 55% of patients are controlled and 45 are not controlled. Even they are taking their medication, but they are not controlled. Now, if we talk about the case mortality rate of diabetes mellitus, those who are dying because of diabetes in Jordan, 7% of the mortality in Jordan, they are dying because of diabetes. Now, if we want to talk about another complication, the risk factor for diabetes in Jordan, we found out that about 61% of population more than 18 are either overweight or obese. So obesity in Jordan is very high. And this is one of the most important risk factor for diabetes, as everybody knows. And we found out that about 85% of Jordanians, they are not eating the 5 cups of fruit and vegetable daily, which is the recommendation of WHO. So 85% of population are not eating healthy food. And also we found out that 33% of the population, they are adding salt to their food. So this is also, it's not the recommendation of WHO. They're not supposed to add salt to their food. That's about some of the important results from STEP survey for diabetes. Now, if we're going to talk about the COVID-19 with diabetes, we found out that about all the deaths in Jordan, we have now in Jordan about 1,467 deaths because of COVID-19 in Jordan. We found out that 21% of this number, they have at least one risk factor. And we found out that 24%, they have two risk factors for chronic respiratory, for the, cardiovascular diseases or non-communicable disease. And we have 7% of the deaths, they have 3 risk factors or more. And we found out that 20% of the deaths because of COVID-19, they have diabetes mellitus. And we found out that 32% of the deaths, they have hypertension. Now also, we found out that 83% of the deaths in Jordan because of COVID-19, they are more than 60 years. And we found out that 5% are less than 45 years of all deaths in Jordan because of COVID-19. That's, I think, one of the most important numbers we can talk about for now. Thank you.
Thank you, Dr. Refqi, for giving us this overview of the status of diabetes and the risk factors and the NCDs in general around the STEP survey, which was before the COVID crisis, and also this analysis of the deaths and what kind of pre-existing factors or diseases that they have been suffering is also important and more important now these days to understand that the risk of diabetes and what it may lead in light of the COVID crisis. And we will come back to this and see what the challenges are and what the ministry has been doing to support these patients. But for now, I would like to move to our next speaker, Dr. Ibtihal Fadel. You have heard what the situation is maybe in Jordan, and you have for sure been following up on Jordan from your work closely through the alliances. And we would love to hear from you more around the role that you foresee for the civil society organizations and their role in diabetes prevention and care in the EMRO region, the Eastern Mediterranean region, which Jordan is part of. So please, the floor is yours, and we'd love to hear from you more insights on this issue.
Thank you very much, Haneen, and thank you for everyone. Good afternoon. I'm very pleased, and thanks to the Royal Health Awareness Society for providing the platform to talk about diabetes specifically and non-communicable disease and the role of the civil society. Can you see my screen?
Yes.
Great. I think when we talk about, first of all, a happy World Diabetes Day 2020, and we know diabetes is really a critical public health issue globally. It's not only in the region, with its tremendous impact on individual health system, community level, and all level. The World Diabetes Day is, as most of all of you know, remind us with this disease, with this horrible disease, and how to deal with it. It's as a time when we raise awareness regarding diabetes, and I'm sure our colleagues here and the panelists will be speaking more about the theme of this year, which is focusing on the nurse's role in diabetes control. But from our perspective, we want also to remind everyone that the patient themselves, they have a great role in controlling diabetes and also in prevention of diabetes, as well as the civil society, which I'm going to elaborate more in what is the role of the civil society here. This here, I'll just remind everyone that when we talk about diabetes, it's one of the major non-communicable disease. Diabetes is one of the 4 non-communicable disease, which is cardiovascular, cancer, and chronic respiratory diseases. And currently, with the huge issue of the non-communicable disease, they include recently, they moved from 4x4 agenda to 5x5 agenda, including mental health, and everyone agrees about the impact of mental health and mental disorder, and also adding a risk factor, the air pollution, to the list of the risk factor, which is Dr. Refqi have clearly pointed out, which the risk factor for non-communicable disease. These diseases collaboratively, including diabetes, they are causing 41 million deaths globally, and as well as in our region. So let's see how they are, what is the profile in our region. I'm sure most of the people have heard that our region, Middle East and North Africa, unfortunately, is regarded as one of the highest, we have country with the highest incidence of diabetes globally. The Eastern Mediterranean region also suffer from the issue of non-communicable disease. The disease is increasing in incidence, and they are a major causes of disability, death, and morbidity. We have nearly now 50 million people living with diabetes in the region. Can you imagine? We have 50 million people who are currently living. And if I put it in the context of what Dr. Refqi have mentioned previously, that in Jordan, there is people who are not aware whether they have a diabetes or not. So, this is the 50 million is the people who are counted in as diabetic cases. So if we look into the people who have high blood and undiagnosed, the number is higher. We have 100 million people who are affected with hypertension. And these, as you know, they are a comorbidity issue. They work together, diabetes and hypertension. They come out in most cases as one package. This is a tremendous impact on the healthcare system. In every country, they will not be able to deal with this huge number of cases. I want also here to remind everyone or highlight the issue that most of the country, they have a global target to attend to. And these targets, either they created for themselves nationally. This is why they keep record of what is the number of diabetic cases, what is the progress, how many people are controlled or not controlled, to populate the target or to address the target. These target, one of them, I should mention the SDG, the Sustainable Development Target, where most of the country, they want to achieve reduction of mortality from diabetes and other non-communicable disease, 30%. Are we okay? Are we on the track? Unfortunately, we are not on the track based on the progress report. We have, globally 17 countries only from the 194 country will be able to achieve the SDG target 3.4, meaning reduction of mortality. So if we are not able to reduce mortality, let's talk about other things which we can achieve working collectively. I'm also here in this slide remind everyone that COVID unfortunately has exacerbated the issue. COVID bring and expose the need for people living with diabetes to be highlighted, and exposed the need for to give this people a higher priority in terms of the planning, implementation, and so on, because COVID has negatively impacted on the services. So most of the health services for diabetic cases has been disturbed, as well as their livelihood, like how they're living, their income, and so on. In the region, when we talk about the diabetes, let's remember a few facts about the region. What is specific in the region? First, I mentioned that we have country with the highest incidence. There is also, as Dr. Refqi mentioned, example of Jordan, high risk of risk factor also for diabetes. So we are not in a good situation to say that we will have a reduction of cases of diabetes. Unfortunately not. We will be seeing increase. Another thing is the lack of access to medicine. In many countries in the region, we have a huge challenge in the access to medicine and the quality healthcare services. People are paying their medicine, if it is available, from their pocket, not from the health system. So they need a support for the payment. I also want to refer and highlight the issue of health literacy. I'm sure you know many people, they don't know why they are affected with diabetes, how to control their disease, what is the progress of their disease. And this the issue of health literacy has a huge impact on the prognosis of diabetes if people affected. And even it has also a huge impact before getting the diabetes if people know how to avoid the diabetes. From that perspective, I think the civil society have a major role to play in terms of informing people, working with the community to improve literacy for diabetes and non-communicable disease. As a group of our network of civil society working in the region, we have the NCD Regional Alliance. We are working with NGOs and civil society from 22 countries in the region, the Eastern Mediterranean region, Middle East, North Africa, and Iran, Pakistan. And we have civil society from area of promotion, patient support group, and area of healthcare. They are working under one umbrella, the regional NCD Alliance. Our mission is to empower the patient. We need to advocate for the engagement and empowering of the patient living with diabetes and non-communicable disease. We are always saying under the umbrella that the decision taking for the care of these people have to be with them. So no decision about their care without involving them. We just heard from Dr. Refqi how important to have data in place regarding the incidence, prevalence, and risk factor. Equally important to have data about what the patient feel, what the patients say, and is the healthy food affordable for them? Is the treatment, why they are not taking the treatment? Is it affordable? Is it accessible? These are the things which we are studying, and we want to see the views and the experience of the people in terms of their diseases. So within this context, I want to tell you about a recent study we have done from, I think this is the first time we explore and gather the views of and the voices of people living with non-communicable disease in the region. And some of them refugee and some of them youth group. And we compiled the finding in one report. This is the views and voices of people. Because we strongly believe that the views of the people is very important in terms of the prognosis and compliance with the disease. I give you some example, like we talk about prevention and how much people have to stick to healthy lifestyle. Hanil, remind me if I exceed the time, we can shift it into.
Yes, you have another maybe 1 minute to
okay. So I I will give you some summary. We say we encourage people to walk and to eat healthy. Now we ask these people, how do they feel regarding healthy? Can they stick to healthy lifestyle? And you see, they come with a few challenges, like healthy lifestyle is not affordable in most of the cases, not only refugee, it's in all cases, in many cases, they recommend that in imposing a policy to ensure that they will be able to purchase a healthy food, to do exercise at the time when they want to do it. So if you have, and also they will request that when they see the doctors in the clinic, they will be counseled about their condition. They will be taught, they will be asked about smoking or not. I have one person saying that I've been a smoker and no one asked me and no one offered me a quit smoking things. And when we ask them, they think the medicine and the treatment is affordable. Majority of the cases, over 60%, they say it is not affordable. They have to pay from their pocket for the access to medicine because they are not insured. So their recommendation is integration of the NCD service would be available, as well as they need to have like for the refugees, they need to have a sort of insurance similar to the national to be the medicine will be available.
Yes.
Another things I think is stigma and discrimination. Have you asked your diabetic cases whether they feel being discriminated before? We have many youth who said they've been discriminated in a school, university, and at work situation. They were not offered the opportunity as another normal person without diabetes, just because they have a diabetes. So this is an issue I want to highlight. I will leave a few messages for the for the later round. Thank you very much for your listening. Over to you, Hanin.
Thank you, Dr. Ibtihal. I think this was really informative and a very important dimension of putting people at the center of any intervention or programming or support mechanism, really understanding it is exactly what you've described, hearing their voices and having them at the forefront of in order to be able to provide the right care and support. So this is very important, and NCD alignment globally and regionally has really been putting an effort to advocate for this issue. So thank you very much for sharing those insights. And now moving on to the more kind of global theme, I have the pleasure of asking Mr. Jacob Madsen from the World Diabetes Foundation, what is it that the World Diabetes Foundation is doing in terms of contributing to the global health agenda, and maybe particularly in humanitarian settings in our region and elsewhere in the globe, and what is it that you are aspiring to do in those settings, difficult settings, COVID settings, humanitarian settings, with regards to prevention and control of NCDs and particularly diabetes?
Yes, thank you very much, Hanin. Can you see my screen?
Yes, we can.
Perfect. Perfect. Thank you so much. Well, first of all, a very warm thank you to RAS for hosting this important event. And thank you to Dr. refqi and Dr. Fadhil for some very interesting and insightful presentations. I will, as Hanan just briefed, speak a little bit about the role of the World Diabetes Foundation in a global perspective and on the global health agenda. And I'll move into some more specific considerations on working with diabetes in humanitarian settings, and finally share some experiences that we have from Jordan in the collaboration that we have with the Ministry of Health here and with RAS. So first of all, this is of course not surprising to anyone here. Diabetes is a global epidemic and it's only getting worse. We project a huge increase in diabetes during the next 20-25 years, as you can see in this graphic. Also, we know that 79% of people with diabetes actually live in low and middle income countries. So this is indeed a huge chunk of the epidemic. So in order to respond to this global epidemic, there's also a global policy framework which is set up. And this consists of the 2013 WHO Global Action Plan on NCDs, which has a target to have a 0% increase on diabetes by 2025. Also, we have the UN Sustainable Development Goals, and in particular Goal 3.4, with the goal of reducing by 1/3 the premature deaths from NCDs through prevention and treatment. So, where are we in terms of following these global policy frameworks? Well, it's very evident this year in 2020 that these targets and goals, they will not be met by 2030 unless we are really investing a lot more into national NCD programs, and especially in the low and middle income countries where we see the biggest chunk of the burden. And we know that NCDs represent 70% of global mortality. And although it is so big, this global mortality rate to NCDs, only 3% of international development funding for health is actually focused on NCDs. So we can indeed say that there is a funding paradox. And if we do not do something very urgent and radical to change this funding paradox, NCDs will remain a significant barrier to development. So there is a global call to action, and we need to address the implementation gap through wider partnerships and alliances. So who are we as the World Diabetes Foundation? Well, we fit into this response, of course, and we are an independent trust dedicated to prevention and treatment of diabetes in low and middle income countries. And our vision is to alleviate human suffering related to diabetes and its complications, specifically focusing on those in greatest need. The way we work through partner networks at various and at different levels. We work at a global level with, for instance, the Global NCD Alliance, with UN agencies, academia, and also other foundations. And at a regional level, we work with UN agencies, also WHO and UNRWA, who's also very relevant in the MENA region. And at national level, our partnerships are focused at ministries of health, NGOs, academic institutions, and private sector. These are some of the outcomes that we have reached through our collaborations since our existence, where we started back in 2002. So as you can see, we have supported the treatment of more than 8 million patients, the screening of more than 20 million, the training of almost 550,000 healthcare staff, and we have supported the establishment of more than 20,000 clinics throughout the world. So now I'll move a little more into some considerations and some experiences from our work in humanitarian settings in specific. We all know here also that the global refugee crisis is significant, and we have almost 80 million people who are forced from their homes, and almost 26 million are refugees. And in order to achieve the Sustainable Development Goals, we will need to have a focus on this big part of people in the world. Otherwise, we will not reach Sustainable Development Goals. So why is it specifically also important to work with diabetes and care, prevention and care in humanitarian settings? Well, we know that 9% of the global population are living with diabetes. And we have estimations that among refugees, these figures can actually be a lot higher, up to 50% higher. And we know also for a fact and from our experience that prevention and care of diabetes is very difficult and very challenged in humanitarian settings because it's difficult to get access to healthy food, it's difficult to exercise, and it's difficult to build the capacity of the healthcare system. in particular because very often in humanitarian settings, the non-communicable diseases are not prioritized so much. And this is also reflected because NCDs are very rarely integrated into humanitarian response plans. And in our work, we have a focus on the Middle East in particular in our work in humanitarian settings, because there are a lot of humanitarian crises here and a lot of refugees, and also combined with high diabetes prevalences. So the point here is very much to highlight that humanitarian responses cannot be separated from NCD responses, and we need integrated solutions to these interlinked challenges. So this is not something that is only our opinion. It was highlighted at the third UN high-level meeting on NCDs in 2018 that we need to recognize a combined NCD and humanitarian crisis burden, and there's a need to strengthen NCD prevention and control in humanitarian urgencies. So our specific experiences on working in humanitarian settings is based on 17 years of experiences. We have financed more than 30 projects throughout various regions in the world with a humanitarian focus. In these specific projects in humanitarian settings, we are collaborating, as in all of our projects, with health authorities, NGOs, UN agencies, International Red Cross, and academia. And this also includes being an active partner in the global dialogue with various UN agencies, International Red Cross, International Diabetes Federation, where we see how best to raise global priority according to NCD prevention and control in humanitarian settings, and in particular among refugee populations. So moving from the humanitarian settings in general, I'll speak a little bit about our experiences from Jordan. Everyone here also know that Jordan can definitely be characterized as a humanitarian setting. Almost 35% of the total population is constituted of refugees, and 80% of refugees live outside camps. So this is a very good example of the need of integration of humanitarian and development responses and NCD responses, where we need to target refugees as well as host populations, because very often they utilize the same services. And it's also evident that the influx of refugees poses a huge economic burden on various institutions in the Jordanian society. And as also demonstrated and shared by Dr. Refqi from the latest STEP survey, we can see that the NCD situation in Jordan is indeed alarming. 80% of deaths are related to NCDs. Diabetes and hypertension prevalences are very high, in particular in the older population. Obesity, tobacco use, lack of physical activities are all risk factors that are also alarmingly high. So the project that we are supporting in collaboration with the Ministry of Health in Jordan and coordinated by RAS is called Integrated NCD Humanitarian Response. And this is very much focusing on exactly trying to have an integrated response targeting the Jordanian host population as well as the refugee population of Jordan. We have a budget of $6.5 million, and this project has been possible also with a generous grant from the Novo Nordisk Foundation of $4 million. And I would like to bring to attention the targets of this project also, which are very ambitious. We expect to target 190 Ministry of Health primary care centers, and also 20 health service units specifically in refugee camps. And we expect that 150,000 patients will receive improved NCD services. So it is indeed an ambitious project with some ambitious targets. On top of this, we also received a special grant from the Novo Nordisk Foundation to support the COVID-19 response. And this is very much, of course, in line with what has already been done by the Jordanian government. So we try to support this response in providing public information and increase awareness about COVID-19, and specifically focusing on NCD patients, and also facilitate the access to health services for NCD patients, in particularly older people. And very characteristic for this grant and this project we are doing in coordination with RAS is facilitating some more innovative solutions where we have online platforms during the COVID-19 pandemic where we cannot meet face-to-face. And through these online platforms, we can capacitate healthcare providers, we can do patient education and awareness raising. So to sum up, I just wish to highlight two very important areas of integration, which we call building of bridges. First of all, I think it's a key point that we need to integrate humanitarian responses and NCD responses, because it doesn't make so much sense to have these two areas of work separated. So we need integrated solutions to interlinked challenges. And likewise, we also see the need for a paradigm change in relation to the silo thinking between infectious diseases such as COVID-19 and NCDs, because people living with NCDs are more vulnerable to COVID-19. So we would also see a need to integrate these responses. And finally, I'll just sum up what we have been doing for the past two decades since our existence. We started as a foundation to focus very much on diabetes specifically. And we followed, of course, the global health agenda and the developments to broaden our perspectives to NCDs in general. And also, we are now seeing how we can integrate NCDs into health systems in general and with other health areas, such as, for instance, COVID-19 and infectious diseases. And all of this is intended to contribute to universal health coverage. And also, we are being very much aware that in order to reach universal health coverage, we need to address the NCD burden in the world. So with the Jordan example and the Jordan project, we wish also to demonstrate that we can indeed, with such a large-scale project, catalyze the translation of the global NCD goals into action at country level. And we wish to be able to showcase that scaled up and full national NCD programs can be possible and implemented in low and middle income countries. We want to show also that integrated responses are the only viable and sustainable solution towards universal health coverage. And finally, we really also wish to showcase that there is a critical role of foundations, philanthropy, and the private sector in health and development, and in particular, to address the funding paradox regarding the response to NCDs, as I mentioned. Thank you very much.
Thank you, Jacob, very much for all the great work and that the World Diabetes Foundation has been pursuing in Jordan, and we are very proud partners with the Ministry of Health as well, and different organizations responding to the different, the NCDs alone are a burden and a heavy burden on low middle income countries, and particularly in areas like Jordan. And we are seeing the brunt of such prevalence in light of COVID and such circumstances, but also not forgetting the humanitarian context that Jordan has been hosting a large number of refugees with a similar health profile, posing an additional and heavy pressure on its health system generally, but also with the support of civil society, the government, the policies, the multinational organizations, and the health-focused, I would say, agendas at the global policy making, at financially supporting such work, I think would make a huge impact on how Jordan and other countries such as Jordan can cope and further more enhance and develop its health profile for citizens in Jordan, regardless of their nationality. And this takes me to Dr. Omar, who is also a partner with us in the job, in the work that Jacob has described under this grant and project we will be implementing together. And Dr. Omar If you could also share from your perspective, and as a leading organization in Jordan, working closely with UNHCR and closely with refugees and vulnerable or uninsured Jordanians, even in local communities, what have you been seeing as Caritas and from your work with refugees? How were refugees living with diabetes particularly affected during this past couple of months? And I would like to focus furthermore on how it was and how it has been, and how lately during the COVID crisis, Caritas was able to extend its support and respond to refugees and COVID together. So the floor is yours, Dr. Amar, please.
Thank you, Haneen. Good evening, everybody. I would take this opportunity also to thank you and say it's an important time during the World Diabetes Day. So thank you again. Concerning how the refugees are living, here I would like to focus on some numbers that Caritas Jordan collected since our responsive work toward refugees, as we are different locations in all over Jordan for taking care of the Syrian and non-Syrian refugees and uninsured Jordanian over the many Caritas medical centers. And here I will take some information from our health information system, the HIS report, that unfortunately the numbers are higher, as my previous colleagues said, that there is a many of the higher percentage in the chronic medication. I would say 60% of our data, it's the condition, and the diabetes number or percentage is around 13.2%, whereas it's becoming the second after the hypertension with the 20 with around 20%. So the problem here is the higher percentage of the chronic medical condition of many refugees, as well as the Jordanians, as well as the local community. And here I would say roughly that within the UNHCR database, and this is all the patients has to update their information. Sometimes we are doing this based on the current information that we have, and accordingly, out of 40,000 registered refugees in Jordan, this is the total refugees who registered in Jordan, 650,000 they are and 12% non-Syrian refugees from other 52 nationalities. These issues give us some complications in how to make sure that the patients all of them are giving a clear and good information of their medical condition. If we are focusing on the Syria here for 60,000 patients with the chronic medical condition, and out of those 60,000 patients, only Caritas, with all the partners from UNHCR and other Caritas partners are working with or are able to cover 16% of the total percentage of the refugees. So this is the fact. The other question, how the refugees are living or how they are coping with the situation. And I would say here allow me to go a little bit before the scene. So since the Syrian crisis starts, all the refugees, mainly Syrians, are covered, or let's say the government maintain their health coverage. And this from 2011 till 2014. From 2014 to 17, the government of Jordan decision to treat them, which led the Syrian refugees only to pay from 35 to 60%. Again, 2018 till 20, the other decision came from the cabinet that 80% they will treat it as uninsured Jordanian, and the coverage is 80% from the government, which is good. And lately, by July, non-Syrian refugees, Iraqi and other nationalities, they are also abide with this rule that they will pay only 20% as uninsured Jordanian. So this is a progress in terms how the government of Jordan are looking for the refugees. Why I'm saying that? Because the access for the refugees in general, it's a problem. The access for the health facility. And here we have to talk about the 4 elements of how the refugees are able to cope with their medication. And the first one is registration or the legal status of their situation. And the recognized refugees, which is there is a few people that they have this full registration, they have this right. By the others, which is mostly they are having they are treated as an asylum seekers, which is they have access, but this is as a limited access according on the budget, according to the registration, according to their nationality. So it's different. And not here there is like a cut or an increase in the budget. So the second point is the access for the facility, and this is important actually, since seeing a limitation in the capacity of the health public health infrastructure. This is lead to the main question whether refugees can monitor their medication or can be treated, would say, in the public hospital, but this is the fact that this is not always available. The third part is the medical costs, the medication costs. As I said, the coverage is 16% out of the 60,000 registered chronic patient, which is it's very limited. The second point, from those 16, they have to cover, or the uncovered patient, they have to find a way to cover their medication. And as you know that the chronic patients, those they are the most vulnerable people, that they are not able to work, that they are not able to find other resilient solution. And the last one is the consultation, which is that maybe they can maintain their medication, maybe somebody can give it to him, but the problem, if they are going to the doctor for having a real medical consultation and a real medical diagnosis, and here we tried times to make sure that healthcare centers, that not means that they have medication, but at least they have access to do a medical checkup and to make sure their repeat prescription, which is the most important, every 3 months, to make sure that there is somebody that doing their medical condition with taking into consideration data protection for their medical history. So this is the main 4 factors that making the refugees a little bit struggling with the current situation. Especially now, Jordan Response Plan didn't maintain a lot of money for the response for the Syrian and for the Syrian or refugee crisis, which is make the health coverage or the medical coverage in the low percentage. As I said, 10,000 patients are covered, which out of 60,000 registered. That means it's not that much number, or we are not able to cover the most of the people. Second point, during this year, the COVID-19, the people really face a real problem. First one, they feel that they are missing from the instructions of the government. Actually, somehow, yes, that most of the instructions made for those insured Jordanian, not for uninsured Jordanians. And this give UNHCR and other partners that the main response to raise the awareness about their health instruction and for also for their medication. So Caritas tried in that time in the curfew and the lockdown to maintain their medication. We maintain to deliver through home delivery the medication because of the curfew for the patients. it takes this, let's say, this service, this service for the refugees, and it was for the 10,000 patients. Nowadays, we are trying to work according to the repeat prescription, the medical checkup, and to maintain the medication every 3 months to make sure that there is an enough quantity of the medication in each house of the patient, to make sure that they are not able to have any shortage. In the same time, we reactivate the telemedicine service, that the people, the patients, and our doctors, pharmacists, nutritionists, that they are able to access the patients and calling them to make sure that they have a clear information about prescription, a clear information about how to use it. Same time, for any complaint or any misinformation, that they can call and to make sure that they are in the safe side in terms of information.
Yes. First of all, I wish to thank you and
Yes.
thank all the efforts for Caritas. We are really grateful to have such a highly responsive organization and supportive of the Ministry of Health as well efforts. I'm afraid
what
that
I would say, Haneen, sorry, the last thing that I want to say,
yes,
that
sorry,
this is not.
your
Can
voice
you hear me?
is cutting off. Yes, better now.
Yeah, sorry. No, what I want to conclude my words with the good initiative that we are doing now with RAS and with the Royal Health Awareness Society for the awareness, because one of the main, let's say, focus right now is the providing health awareness because we are not able to cover the medication costs. Whatever we did, we are not able to maintain their medical every day. So what's the alternative plan? And this is maybe part of my last comment or last recommendation, is to focus on the three main components, which is the awareness and the physical activity and the lifestyle through the nutrition advices, which is now currently we are working together with Ra in this. So I just want to make sure that the focus now on those three main components, and this is, I think, the sustained activity that can let the Syrians or any refugees, even uninsured Jordanian, feel that they are under control. Thank you.
Thank you so much, Dr. Omar. I think we have, kind of buckled the whole context in Jordan, and even from the government perspective, from civil society perspective, from global organizations who are investing in our NCD's fight, and particularly against diabetes, as well as putting the patient at the center of it all, making sure that we are looking at sustainable solutions. We're not fragmenting our efforts. We are trying, even with limited resources, to respond in a smart way, I would say, to the different challenges that are being posed on the health sector and system, and more recently in light of COVID. So we have a few minutes left, and I'm not sure we have a lot of time to take the questions we have from Facebook, but there are two questions that I would like to ask the panelists to respond to. One is, how can we make a balance, and how can we take care of population health from one aspect while being patient-centered at the same time? I think this question is for Dr. Ibtihal mainly. And the other question is, how effective do you think telemedicine is in addressing the needs of NCD's patients? how do you ensure the sustainability and, more importantly, the access, and especially in humanitarian settings? I mean, this is one of the questions, the effectiveness of the telemedicine as one solution for accessing counseling services, etc., for people. And maybe I would leave this question for any of the panelists, Dr. Amr Jacob, Dr. Refqi, to comment on that. And then we will have our closing remarks by each of you. So Dr. Ibtihal, if you'd like to respond to the first question.
Yeah, I think rightly said by previous speakers, you know, patient engagement and empowerment and awareness. And I mean, when we say engagement, empowerment, it has to be by raising their awareness and make them more informed, is a critical part of the whole process. Because whenever you provide a best health system in the world, if the patient are not well informed, they will not be able to respond and address their need as rightly as we expect. So we have many examples. I mean, we can refer to. I mean, if you see the latest training we had in Jordan with the Royal Health Awareness Society with RAS, we engage refugees who are affected with diabetes and other non-communicable disease, and we can see how people believe and perceive their disease is related to different things. They are not, you know, clearly aware that what is the disease, how much is related to what they are doing, and what is the compliance with medication or compliance with the prevention. And this was eye-opener for us as well as for the patient. And by doing such a training and empowering the patient, they will be a change agent. They will be a change agent for themselves as well as for the community. So I strongly encourage for investment in patient education, patient awareness, empowering them, especially with the youth population who are affected. They will be the change agent to change to change what they do and minimize the incidence of diabetes as well as they improve the prognosis. And for the healthcare worker, we are saying again, you have to acknowledge the patient experience. You have to respect the patient views and voices, and because they have lived experience, they know about their diseases. So without acknowledging that, you don't expect the patient will respond to the treatment in the right way you wanting. And counsel the patient. This is very important. So we have to do it collectively, whether from the patient side, from the community side, health worker side. We work together to improve the situation, because diabetes will not disappear from our region. Unfortunately, we are expecting more cases. So if we don't work together as a collectively, we will not have a better future. Thank you. Over to you.
Thank you, Dr. Ibtihal. Yes, indeed, I think it needs a lot of coordination and collaboration. I would like to see who from the panelists would like to comment. Dr. Refqi, you had a comment on the effectiveness of telemedicine, maybe, and if, yeah, please.
Yes, thank you very much. First, what I would like to say, first of all, is I really like the theme for World Diabetic Day for this year, 2020, which they was talking about those who are providing cares to patients. Because in the last years, they always was talking about patients for the theme of World Diabetic Day. Now they are talking about the nurses and diabetes. And I really like this theme. We're talking about those who are providing cares and management to the patients, which they are mostly nurses who are doing this. So I'm really very happy for this theme for this year. That's one thing. Another thing about the integration of diabetes in primary health care. Now in Jordan, we are working, we start working on the HEARTS protocol, which there was integration, hypertension and diabetes in primary health care. And we are talking about now not only a disease, we're talking about the cardiovascular risk assessment. And in our STEP survey, we found out that 1/4 of our population, they have risk for cardiovascular with a 10 years, more than 30%. So it's very high percent of those who have risk factor for cardiovascular disease. That's one thing. Other thing, in the mortality report for last year in Jordan, we have now the 80% of cause of death in Jordan is according to NCD. It increased from 78 to 80% in 1 year. That's other thing. The other thing about the telemedication, yesterday we had conference meeting with also WHO for implementing a telemedicine in Jordan for those NCD. The most important thing here, Jordan, which I was talking also, always talking about, is the records of patients. Because in Jordan, still now, we don't have a diabetes registry in Jordan. So we have a lack of information about the patient, telephone numbers and address. So it's not easy to deliver medication to patients' homes. So we need to have a registry for diabetes mellitus so we can have a complete information about each patient. Now we have collective information about patients, not individual information. That's a big problem for implementing a telemedicine program in Jordan. But we are trying to implement so we can collect data from each patient. Thank you.
Thank you, Dr. Refqi. I think definitely data is very crucial in any intervention design, but also it's good to know that telemedicine is being studied as a form of supporting NCD's patients. And especially in light of these circumstances, now they are more important than ever. And I think we have also part of our upcoming plan to provide some telemedicine solutions for uninsured Jordanians and refugees through this World Diabetes Foundation and the Novo Nordisk Foundation grant with Caritas and with other partners. So we are a bit over time with our session, so I would kindly like to ask our speakers to give in one statement or your final word as hopes, aspiration, or advice on this year's World Diabetes Day, inspired by your work in general. So I will start with Jacob.
Yes, thank you very much, Hanin. And thank you very much to everyone for the insightful presentation. I think, first of all, we see an alarming increase in the prevalences of NCDs in Jordan, as presented by Dr. Refqi. We have an alarming influx of refugees as well, who are very vulnerable to NCDs. And at the same time, on top of this, we have COVID-19, especially hitting NCD patients, and in particular, refugees who are vulnerable to NCDs. So I think with the funding paradox that we are seeing towards the response to NCDs becomes even more alarming in this context. And also that we rarely have NCD responses integrated into humanitarian responses. So my hope is that more people and more organizations and more institutions will join forces in order to address the funding paradox. And also my advice would be, based on what our experiences is from humanitarian settings, to do more integrated responses, integration of humanitarian responses, NCD responses, as well as infectious disease responses and NCD responses. And at the World Diabetes Foundation, we will do everything we can to support these processes.
Thank you very much. So integration and a combination to fight the NCDs, but also to find the funding gap issue that stands in the way. Dr. Refqi, please, your final words and advice.
Well, I think the most important what we can do for patients is to provide them their medication at home. I think it's now health centers are at very risk of receiving the old age patients and those who have high risk, which they have one or more NCD diseases. So I prefer to start delivering their medication to homes rather than bring patients to high risk areas. And really I appreciate all collaboration with all NGOs, especially with RAS and World Diabetic Foundation also to supporting MOH for doing all their programs. Thank you.
Thank you, Dr. Rifqi, and maybe Dr. Ibtihal, you can also share your hopes and aspirations for this World Diabetes Day.
Yeah, thank you very much. I think civil society have a great and critical role to play in terms of the diabetes agenda. So we encourage engagement of the civil society in the decision-making process. As we can see, you know, the civil society is more approachable to the community and public, and taking the perspective of the patient and journey of the patient and bring it to the decision table is very important in this process. And the last word, diabetes prevention, is a critical and key. It should be well addressed beyond, you know, when we try to build back better, we should invest into diabetes prevention as well as other non-communicable disease. Thank you.
Thank you, Dr. Ibtihal. Dr. Umar.
Thank you, Haneen. Maybe I would repeat your words. It's this word, the Diabetic Day. I think the importance to be together and to make such as alliance or to work in real partnership to have a good defensive role of the awareness and through the awareness and through other tools to make sure we are not able, as doctor said, to fight and to pay the cost. We have to look for other real tools and free tools. Awareness is one of the important, and I to expand more the partnership and the efforts against NCD in general and diabetes in particular. So thank you.
Thank you. Thank you, everybody. Thank you, our esteemed panelists, for your time, for your insights, and more importantly, for your approach in taking diabetes prevention and care, not only in outside Jordan, but particularly inside Jordan, forward. And I'm sure that many people all these efforts will bear fruit for so many people. And these models that are done in cooperation, in integration, in doing what we do best, but together, I think is the best way forward in light of all these different challenges and circumstances that are around us. And always to keep the hope and possibly the positive way of looking at things, and taking stock of all the learnings that the different crises pose at us, and see where the opportunity really lies, and making sure that we seize it. So thank you again for your time, and I apologize for keeping you extra few minutes than the time that was scheduled, but it was really interesting to hear from you and to learn from you as always. And I hope that we meet again, hopefully in person soon enough, and stay safe, everyone, and take care. Thank you very much again.
Thank you. Thank you.
Thank you very much. Thank you.
Thank you.
Thank you.
Bye-bye.